Hello, my name is Cristina Toncel, and today I'm going to be talking about the USAID withdrawal in Colombia and how it affected the public health in the country. For starters, I'm going to be giving a little bit of context on the topic, and then I'm going to be responding some questions and defending my point. So, for starters, what is USAID? USAID stands for the United States Agency for International Development. It is a branch of the United States government that was established in 1961 by President John F. Kennedy in search for helping developing countries. Its mission is to promote economic development, democracy, health, and education stability in developing countries, and it operates in more than 100 countries, especially Latin America, Africa, Asia, and the Middle East. In Colombia, its major role, or well, given it from a point of view of a medical student, it's the help in HIV treatment and medication to HIV patients in Colombia. Trump and USAID. In early 2025, President Donald Trump received his new president title, presidential title, and he decided to make some cuts in USAID, including Colombia. The cuts in Colombia resulted in the freezing of approximately $70 million US dollars that were designated for environmental and conservation projects. But the consequences of this did not only affect environmental projects, but also the healthcare problems. Because the NGO, Red Somos, I'm going to talk right here, has retained more than 3,000 bottles or units of medicine that were designated for HIV patients. This has a major impact in Colombia in public health, not only for Colombians, but for immigrants, because when an HIV patient stops receiving his medicine or her medicine, the virus becomes or reactivates himself. And this causes the patient to be a transmitter again of the virus, or also for his health to start deteriorating again, making them more susceptible to multiple diseases and infections, and it becomes a public health problem because they become transmitters. And as we may know, there is an actual new wave of HIV diagnosis in the whole of Colombia. This also affects Venezuelan immigrants in Colombia because there are lots of immigrants that don't have the needed documentation to receive medication from the country itself. And they are living here, they are here. So, as a country, we are responsible for what happens to them and what they or how they can affect our public health and our health system. As we may know, Venezuelan immigration is a huge topic. It's not new, it's been happening for years, and it's a little bit of a controversial topic, but for the main context of this situation is that they are not receiving their medication. Also important to know is that there is known to be 3,000 bottles of medicine that are going to expire in 2025. These are the same 3,000 bottles that Red Somos have retained and are not um, going to give unless the USAID program is restarted. So, how does HIV and AIDS affect public health? I already talked a little bit about this, but mainly it is, first of all, it's a really expensive disease, so it costs our system a lot of money that our country doesn't have entirely. So that's why we received the USAID aid for this topic. Second of all, it's not curable, but it's treatable. What does this mean? The disease itself does not have a cure, but it can be treated. We can control the viral load of each patient, making them or helping them continue living a normal life, or at least in the best way possible, a healthy life for them when they are receiving this medication. This medication helps them restart their immune system so they can be protected against diseases and infections. While they do not receive this, the viral load will increase again, causing them to become transmitters so they can transmit the disease to another person of the population. And also it affects their own health by having pneumonia, meningitis, and a lot of other diseases that are related to the itself, that causes a lot of money for our public health and our health system. What is a possible solution? Well, this is not an easy problem to resolve. A possible solution for this is that the government of Colombia takes out um, a little bit of money from a contingency program or something like that. But we do know that it's not completely possible. So a long term solution will be that the government invests a little more money on the contingency programs and also on the health system. But this is not a thing that will resolve our problem in the short term as we need it to be. Another solution would be to ask some other institutions for help, like the United Nations, maybe some philanthropic um, organizations, for a little bit of funds and donations so the country can at least defend itself and its people for in the short term, and start thinking about how are we going to resolve this and or solve this in the long term. So this is mainly the context. But for the question about what sustainability goal this can resolve, the main sustainability goal that this will be resolved is the sustainability goal number 3, which is good health and well-being. And also, I need to add to respond some other questions, like if I could travel to the country, I live in the country, on a technical trip, what would I do first to deal with some of the problems stated above? Well, at my scale, at what I can do is maybe start some campaigns about HIV education and AIDS education, and how you can prevent them and how you can start your treatment once you get your diagnosis. And also um, tell people to go check themselves, because most people don't always check themselves in their sexual well-being, and this is super important not only for them but for the people around them as well. If my group or I were hired to work on solving some of those problems, what exactly would you do and how? Well, I already told you what I could do. But to solve this, mainly I could do it from the point of view of a medical student, and is the same thing, talking to patients, giving them or making them feel safe to talk to me, so I can see how I can help them. Because most people, when you still ask some questions about their sexuality, they do not feel comfortable talking about it, and they hide a lot of stuff that will be important in the overall their well-being. Make a short conclusion about the topic of your project. Well, the short conclusion about my project is that this is not an easy problem to resolve. There are a lot of major topics in it, politics and egos and power involved. But on the real way to solve the problem is, first of all, more health education in Colombia. Second of all, the immigration crisis. Third of all, the country needs to start thinking forward. So when bad things happen, not thinking that they're going to happen, but thinking that they could happen, and start saving a little bit more money on their contingency programs. Now, for my self assessment, what did I learn while making the English project? Well, I learned a lot about the news about this. I already knew about the HIV topic in Colombia and how it's been recently again being a huge topic, but I didn't know about the US aid and how it affected directly on this topic. What was the most enriching aspect of this process? Well, I think mixing my career and this course, I was very happy that I could choose a topic about that, well, that involved somehow my career. And yeah, that was the more enriching aspect about it, that I could talk about something that I actually work with every single day and that actually passionates me and that I'm passionate about. How can I apply this project's process and learning aspects in my or your academic interdisciplinary field? The research part, most definitely in medicine we do a lot of research, and this project needed some research to be done. So I really liked it, and I had to do this research in English and mostly be based on the United States point of view and the Colombian states point of view. So mostly the research. How can I contribute to peace and prosperity through this project? Well, I don't know directly if peace and prosperity, but again, health education and sex education. It's really important. And I think that most people don't think that sexual education is actually part, or sexual well being is actual part of your health in general. It's still part of your health. It's not a taboo or a cringy topic. It's something that you need to talk about with your physician and or your doctor for your well being. And based on my work, assign yourself a grade between 1 and 5. Um, Based on my work, I will give myself a 4, mostly because I haven't been able to turn in my second part of the project because I'm waiting for suppletory for it. But yeah, I think I already passed my time, so thank you very much. I hope you like it. Bye.